Good afternoon, everyone. So, my topic is about the bones and muscles of the forearm. The forearm contains two bones, the radius and the ulna. So, this is the radius. This one is the radius. The radius is the lateral bone of the forearm. So, in the forearm, there are two bones. This is the radius. It is oriented laterally, and this is the ulna. The radius proximal end articulates with the humerus at the elbow joint and with the ulna at the proximal radio-ulnar joints. So this is the elbow joint. So the radius articulates with the humerus and with the ulna. The distal end articulates with the scaphoid and the lunate bones of the hand at the wrist joint and with the ulna at the distal radio-ulnar joint. This is the distal radio-ulnar joint, and this is the articulation of the radius between the radius and the scaphoid and the lunate bones of the hands. At the proximal end of the radius is a small circular head. So this is the head of the radius. The upper surface of the head is concave. So it is concave and it articulates with the convex capitulum of the humerus. The circumference of the head articulates with the radial nuts of the ulna. The other parts of the radius, the neck. The neck is the constricted part below the head. So this is the neck of the radius. The bicipital tuberosity is located below the neck. This is for the insertion of the biceps muscle. This is the bicipital tuberosity. The shaft of the radius is wider below than above. So the interosseous border, which is located medially, is for the attachment of the interosseous membrane that binds the radius and the ulna together. So this is the interosseous border of the radius. The pronator tubercle, this is for the insertion of the pronator teres muscle. It lies halfway down on the lateral side of the bone. This is the pronator tubercle in this area. While the styloid process is located at the distal end of the radius, this projects distally from its lateral margin. So this is the styloid process of the radius. The ulnar nuts is located on the medial surface, which articulates with the round head of the ulna. So the inferior articular surface articulates with the scaphoid and the lunate bones. This is the styloid process. This is the ulnar nuts. The dorsal tubercle is found on the posterior aspect of the bone on the distal end. So it is a small tubercle which is grooved on its medial side by the tendon of the extensor pollicis longus. This is the dorsal tubercle of the radius. On its medial side is notch for the tendon of the extensor pollicis longus. The second bone of the forearm is the ulna. So it is the medial bone of the forearm. So its proximal end articulates with the humerus at the elbow joint and with the head of the radius of the proximal radioulnar joint. While its distal end articulates with the radius of the distal radioulnar joint, but it excluded from the wrist joint by the articular disc. So ito yung ulna. So it does not directly articulates with the carpal bone. So there's an intervening articular disc. For the parts of the ulna, the first one is the olecranon process. So this is the olecranon process. This forms the prominence of the elbow. So the proximal end of the ulna is large. So if you will palpate your elbow, the one that is prominent and can easily palpated is the olecranon process. So it has a notch on its anterior surface. It has a notch, and this is the trochlear notch, which articulates with the trochlea of the humerus. So below the trochlear notch is the triangular coronoid process. This is the coronoid process, which has on its lateral surface the radial notch for articulation with the head of the radius. So this is the radial notch. The shaft of the ulna tapers from above down. So it has a sharp intrussus border laterally for the attachment of the intrussus membrane. The posterior border is round and subcutaneous and can easily be palpated throughout its length. Below the notch is the supinator crest. So below the radial notch is the supinator crest. So this is the area of the, this is for the origin of the supinator muscle. At the distal end of the ulna is the small rounded head. So this is the head of the ulna, which has projection from its medial aspect, the styloid process. This is the styloid process of the ulna. So the interosseous membrane is a strong membrane that unites the shafts of the radius and the ulna. It is attached to their interosseous borders. So this is the interosseous membrane. So it is attached to the interosseous border of the radius and the interosseous borders of the ulna. So its fibers run obliquely downward and medially so that a force applied to the lower end of the radius, for example, falling on the outstretched hand, is transmitted from the radius to the ulna and from there to the humerus and the scapula. So the fibers of the interosseous membrane are taut in the forearm is in mid-prone position. That is the position of function. So the interosseous membrane also provides attachment for the neighboring muscles. For the fascial compartment of the forearm, so the forearm is enclosed in, this is a cross-section of the forearm. So the forearm is enclosed in deep fascia. So this is the deep fascia of the forearm, which is attached to the periosteum of the posterior subcutaneous border of the ulna. This is the ulna, this is the radius, this is the posterior border of the ulna. So this fascia, together with the interosseous membrane and the fibrous intermuscular septa, divides the forearm into several compartments, each having its own muscles, nerves, and blood supply. So again, this is the cross-section of the forearm with the deep fascia covering the forearm. the interosseous membrane, and the intermuscular septa. The muscles of the anterior fascial compartment of the forearm are divided into three groups: the superficial, intermediate, and the deep group. So for the superficial group of muscles, consists of the pronator teres, the flexor carpi radialis, palmaris longus, and the flexor carpi ulnaris. Superficial group, flexor carpi ulnaris, palmaris longus, the flexor carpi radialis. So this is the superficial group of muscles. Flexor carpi ulnaris, palmaris longus, flexor carpi radialis, and pronator teres. For the intermediate group, consisting of the flexor digitorum superficialis. So this is the flexor digitorum superficialis. Again, the intermediate group, flexor digitorum superficialis. And for the deep group, consisting of the flexor pollicis longus, the flexor digitorum profundus, and the pronator quadratus. The flexor digitorum profundus. So this is the deep group of muscles: pronator quadratus, flexor pollicis longus, and the flexor digitorum profundus. So the blood supply to the muscles derived from the ulnar and the radial arteries. So for the nerve supply, all muscles are supplied by the median nerve, so and its branches, except the flexor carpi ulnaris and the medial part of the flexor digitorum profundus. So the medial part is supplied by the ulnar nerve. So these are the muscles of the anterior fascial compartment. So the pronator teres, the action of the pronator teres is pronation and flexion of the forearm, while the flexor carpi radialis flexes and abducts the hand at wrist joint, while the palmaris longus, it flexes the hand. The flexor carpi ulnaris flexes and adducts the hand at wrist joint. With the action of the flexor digitorum superficialis, it flexes the middle phalanx of the fingers and assists in flexing the proximal phalanx and hand. While the flexor pollicis longus flexes the distal phalanx of the thumb. And the flexor digitorum profundus flexes the distal phalanx of fingers, then assists in flexion of the middle and the proximal phalanges and wrist. The pronator quadratus pronates the forearm. This is the cross-section at the level of the palm or the wrist joint. So these are the superficial group of muscles. This is the flexor retinaculum. Flexor digitorum superficialis and the flexor digitorum profundus. Again, the superficial group of muscles: pronator teres, flexor carpi radialis, palmaris longus, and the flexor carpi ulnaris. The superficial group of muscles possess a common tendon of origin, which are attached to the medial epicondyle of the humerus. So this superficial group of muscles has its common origin from the medial epicondyle of the humerus. This is the medial epicondyle of the humerus. For the arteries of the anterior fascial compartment of the forearm, the first one is the ulnar artery. So, the ulnar artery is the larger of the two terminal branches of the brachial artery. So it begins in the cubital fossa at the level of the neck of the radius. So it descends through the anterior compartment of the forearm and enters the palm in front of the flexor retinaculum in company with the ulnar nerve. Cross section, this is the ulnar artery. So medially oriented is the ulnar nerve. So ulnar artery ends by forming the superficial palmar arch, anastomosing with the superficial palmar branch of the radial artery. So in front of the flexor retinaculum, it lies just lateral to the pisiform bone and is covered only by skin and fascia. So this is the site for taking the ulnar parts. So branches of the ulnar artery, muscular branches to the neighboring muscles, recurrent branches that takes part in the arterial anastomosis around the elbow joint. So this is the ulnar artery, this is the radial, this is the ulnar artery. So it has recurrent branches to the elbow joints, the anterior and the posterior ulnar recurrent arteries. So it has branches that takes part in the arterial anastomosis around the wrist joint. Another branch is the common introitious artery. So this is the common introitious artery. It's a branch of the ulnar artery. So the common introitious artery divides into the posterior introitious, which lies behind the introitious membrane, and the anterior introitious artery in front of the introitious membrane. The common introitious artery, which rises from the upper part of the ulnar artery and after a brief course divides into the anterior and posterior introitious arteries. So the introitious arteries are distributed to the muscles lying in front and behind the introitious membrane, and they provide nutrient arteries to the radius and ulna. So the other blood supply comes from the radial artery. So the radial artery is the smaller of the terminal branches of the brachial artery. So it begins in the cubital fossa at the level of the neck of the radius. So it passes downward and laterally beneath the brachioradialis muscle and resting on the deep muscles of the forearm. So in the middle third of its course, the superficial branch of the radial nerve lies on its lateral side. In the distal part of the forearm, the radial artery lies on the anterior surface of the radius and is covered only by skin and fascia. So the artery has the tendon of the brachioradialis on its lateral side and the tendon of the flexor carpi radialis on its medial side. So this is the site for taking the radial pulse. This is the radial artery. And this is the ulnar artery. So the branches of the radial artery in the forearm, just muscular branches to the neighboring muscles, recurrent branches which takes part in the arterial anastomosis around the elbow joint. So these are the recurrent branches of the radial artery. And another branch is the superficial palmar branch, which arises just above the wrist. It enters the palm of the hand and joins the ulnar artery to form the superficial palmar arch. The superficial palmar branch of the radial artery forming the superficial palmar arch together with the ulnar artery. This is the superficial palmar arch and this is the deep palmar arch. The nerves on the anterior fascial compartment of the forearm, the first one is the median nerve. So the median nerve is derived from the lateral and the medial cords of the brachial plexus. So the root of origin from C5 to C8 and P1. So the median nerve leaves the cubital fossa by passing between the two heads of the pronator teres. It continues downward behind the flexor digitorum superficialis and rests posteriorly on the flexor digitorum profundus. At the rest, the median nerve emerges from the lateral border of the flexor digitorum superficialis and lies behind the tendon of the palmaris longus. So the median nerve enters the palm by passing behind the flexor retinaculum. So this is the median nerve. It is derived from the medial and the lateral cords of the brachial plexus. So this is the median nerve with its branches. And at the level of the palm, so this is the flexor retinaculum. It enters the palm behind the flexor retinaculum. So again, it is located behind or posterior to the flexor retinaculum. This is the median nerve. Branches of the median nerve, the muscular branches in the cubital fossa to the pronator teres, the flexor carpi radialis, palmaris longus, and the flexor digitorum superficialis muscles. It also gives off articular branches to the elbow joint. It gives off the anterior interosseous nerve and the palmar cutaneous branch to the skin over the lateral part of the palm. So it innervates the lateral part of the palm. The anterior interosseous nerve arises from the median nerve as it emerges from between the two heads of the pronator teres. It passes downward on the anterior surface of the interosseous membrane between the flexor pollicis longus and the flexor digitorum profundus. So it ends on the anterior surface of the carpus by supplying the joints of the hands. So these are the branches of the anterior interosseous nerve. Muscular branches to the flexor pollicis longus, pronator quadratus, the lateral half of the flexor digitorum profundus. So the medial half of the flexor digitorum profundus is supplied or innervated by the ulnar nerve. It also gives off articular branches to the wrist, distal radioulnar joint, and also to the joints of the hands. So another nerve is the ulnar nerve. So it is derived from the medial cord of the brachial plexus, C8 and T1. It passes from behind the medial epicondyle of the humerus. It crosses the medial ligament of the elbow joint and enters the front of the forearm by passing between the two heads of the flexor carpi ulnaris. So it runs down the forearm between the flexor carpi ulnaris and the flexor digitorum profundus muscles. So in the distal two-thirds of the forearm, the ulnar artery lies on the lateral side of the ulnar nerve. So at the wrist, the ulnar nerve becomes superficial and lies between the tendons of the flexor carpi ulnaris and the flexor digitorum superficialis muscles. The ulnar nerve enters the palm of the hand passing in front of the flexor retinaculum and lateral to the pisiform bone, and here the ulnar artery lies lateral to it. And this is the ulnar nerve. So it passes in front of the flexor retinaculum and lateral to it is the ulnar artery. So for the branches of the ulnar nerve, those muscular branches to the flexor carpi ulnaris and to the medial half of the flexor digitorum profundus. It gives off articular branches to the elbow joint and the palmar cutaneous branch or sensorial innervation to the skin over the hypothenar eminence or the medial part of the palm, the medial half of the palm. And it also gives off the dorsal posterior cutaneous branch which is distributed on the skin posterior surface of the hands and fingers. So again, this is the flexor retinaculum. So the structures passing to this structure are the ulnar nerve on the medial side and the ulnar artery. So posterior to the retinaculum is the median nerve and also the radial artery. For the clinical notes, absent palmaris longus. So the palmaris longus muscle may be absent in one or both sides of the forearm in about 10% of persons. So because the muscle is relatively weak, its absence produces no disability. For the compartment syndrome of the forearm, so the forearm is enclosed in a sheath of the fascia. So there's a very little room within each compartment. So any edema can cause secondary vascular compression of the blood vessels. Soft tissue injury is a common cause and early diagnosis is critical. So the early signs include altered skin sensation. This is caused by ischemia of the sensory nerves passing through the compartment. Another sign or symptom is pain disproportionate to any injury. This is caused by pressure on nerves within the compartment. Pain on passive stretching of the muscles that pass through the compartment. This is caused by muscle ischemia. And tenderness of the skin over the compartment. And this is a late sign caused by edema. Also, the absence of capillary refill in the nail beds caused by pressure on the arteries within the compartment. So once the diagnosis is made, so the fascia must be open or incised surgically. So the procedure is known as a fasciotomy. This is done to relieve the pressure so within the compartment. So this is an example of fasciotomy. Wherein you open the deep fascia to release the pressure and compressions of the blood vessels and nerves. Another condition, the Bookman's ischemic contracture. This commonly follows fracture of the distal end of the humerus or fractures of the radius and ulna. So in this syndrome, a localized segment of the brachial artery goes into spasm. So this is a spasm of a part of the artery, reducing the arterial flow to the flexor and extensor muscles so that they undergo ischemic necrosis. So the flexor muscles are larger than the extensor muscles. So they are the more vulnerable or mainly affected. So the muscles are replaced by fibrous tissue which contracts and producing the deformity. So this is the deformity in patient with Bookman's ischemic contracture. So this flexion of the interphalangeal joints, extension of the metacarpophalangeal joints, flexion of the wrist joint, adduction of the thumb, pronation of the forearm, and flexion of the elbow. I think that's the end of the slide. So do you have questions?
Wala ina-adder the foreman na yan.
Check. So may mga question kayo regarding sa topic? So anong next topic ko, Ann? May schedule na.
Next topic mo po ay posterior compartment of the thigh. Hip joint.
Your compartment of the thigh. Kailan yun?
Why nakasulat na
Wala
dito?
pa schedule? Okay, sige. So wala kayong question, mas ano, related to the topic. Clinical. Position sa forearm. Next na tayo. May attendance na.
Nag-attendance na daw. Tapos na po.
Okay. Thank you.
Thank you, Doc.
Thank you, Doc.
Thank you, Doc.
Thank you, Doc.
Thank you po, Doc.
Thank you, Doc. Thank you, Doc. Thank you, Doc.
Thank you, Doc.